After studying this module, you shall be able to know about classification of psychiatric disorders, certain psychiatric disorders and their characteristics, significance of the study and classification of psychiatric disorders. First, the introduction. The classification of psychiatric disorders is also known as psychiatric nosology or psychiatric taxonomy. The categorization of mental disorders is a significant characteristic of psychiatry and other mental health professions and an imperative concern for people who may be diagnosed. There are at present two generally recognized symptoms operational for categorizing mental disorders. First is International Classification of Diseases, formed by the World Health Organization, and the other is the Diagnostic Statistical Manual of Mental Disorders, DSM, formed by the American Psychiatric Association, APA. Both list the classes of disorders supposed to be diverse types and which have purposefully conjurated their codes in contemporary reconsiderations so that the manuals are often largely comparable even though substantial differences remained. First, the classification. Some of the psychiatric disorder that is liable to lead the sufferer into the conflict with the law can be broadly classified as mental retardation, organic psychosis, functional psychosis, neurotic disorders, personality disorders, and sexual deviations. First, mental retardation. In 1927, the Mental Deficiency Act recognized three groups of mental disorders resulting from the defects in the developmental process of brain, namely idiocy, imbecility, and feeble-mindedness, or the morons. All of these are generally grouped under the term amnesia. The term is now replaced in the new classification of mental disorders by the term mental retardation and includes mental subnormality and mental handicap. Mental retardation is also called as intellectual disability or learning disability, a comprehensive disorder seen before maturity and distinguished by particularly impaired cognitive working and areas in two or more adaptive behaviors. It was historically known as the intelligence quotient score under 70. The word mental retardation signifies a condition of retarded, incomplete, or abnormal mental development. It may be present at birth or may manifest during early childhood. It can be present since birth or may be acquired. It is ranged in accordance to IQ levels as mild, moderate, severe, and profound. The severely distressed have a multiplicity of developmental defects, mental as well as physical, and does not stay alive long even with expect nursing care. In relation to medico-legal practice, the term mentally retarded is usually to indicate a person with low intelligence and also with impaired social functioning. The impaired social functioning is characterized by abnormal aggressiveness and serious irresponsible conduct. The impairment in social behavior may sometimes need the court to appoint a legal guardian. The inability of such a person to learn from his conduct means that he can repeat his wrongdoings. Example, shoplifting, theft, housebreaking, and even more serious crimes such as arson, sexual offences, and murder. Mental retardation may be advanced as a ground for mitigation, reason for diminished responsibility, or to be exempt guilt as sufferers are unable to judge the nature and penalty of their acts. Organic psychosis. Psychosis is distinguished by escape from realism, or if living in another world, a world of fantasy. In organic psychosis, structural or psychological dysfunction directly or indirectly affecting the brain is known to cause the psychosis. First is dementia. Dementia is a wide group of brain diseases that generate long-term loss of the capacity to think, and as it sufficiently rigorous to influence a person's everyday performance. The very most general form of dementia is Alzheimer's disease, 75%. Dementia becomes more common with age, while only 3% of individuals between the ages of 65 to 74 have dementia. 47% of individuals above the age of 85 have some kind of dementia. As more individuals are surviving for long, dementia will become more general. Dementia affects the brain's ability to think reasonably and remember clearly. The most general exaggerated areas comprise memory, visual spatial, language, awareness, and decision-making function, that is problem solving. The majority of dementia is slow and progressive. The person indicates signs of the disease, the progression in the brain have been occurred for a long time. When individuals with dementia are put in situation away from their capacity, there may be an unexpected amend to cry or irritation, which is known as catastrophic reaction. Further, psychological and behavioral problems that often influence individuals who have dementia comprise of impulsivity, depression and anxiety, memory distortions, balance problems, verbal communication and linguistic difficulty, difficulty consumption or swallowing, delusions or hallucinations, tremors, wandering or restlessness. Second is drug-induced psychosis. Drug-induced psychosis or substance-induced psychosis, usually called as toxic psychosis, is a form of substance-related disorder where psychosis can be due to matter use. It is a psychosis that outcomes from the toxic special effects of chemicals or drugs, even including those which are produced by the body itself. A variety of psychoactive compounds have been caught up, creating or deterioration psychosis in users. Psychosis is also noticeable as confusion and visual hallucinations. It is a situation in which a person's psychological ability to identify realism, converse, and connect to others is weakened, thus intrusive with the capability to deal with the life demands. While there are numerous kinds of psychosis, substance-induced psychosis can be interrelated to particular chemicals. Some of them are alcohol. Alcohol is a general reason of psychotic disorders, which may happen by severe intoxication, persistent alcoholism, removal or acute idiosyncratic reactions. It usually produces delirium tremens in a chronic alcoholic, resulting in a state of excitement with hallucines is usually which last for 3 to 4 days, and Charkov's psychosis, which is identified by disorientation, hallucinations and multiple neuritis. The patient's memory for the recent events is lost and he starts filling these gaps by confabulation. The state lasts for about 1 month to an year. Next is cannabis. Continuous use of this drug produces insanity known as hashish psychosis. It is characterized by a much higher level of hallucinations. The addict is likely to commit sexual jealousy, crimes of homicidal nature. Some studies point to that cannabis, particularly various strains comprising great portion of tetrahydrocannabinol and low portion of CBD, may inferior the doorstep for psychosis and thus assist to activate full-blown psychosis in some individuals. Current studies have established a boost in danger for neurosis in cannabis users. Next is LSD. Prolonged usage of LSD may result into depersonalization, acute anxiety and psychotic episodes which may last for months or years. Next is cocaine. Psychosis due to continued usage of cocaine is generally characterized by hallucinations, chiefly visible and tactile. Continued usage over a long time may lead to mental and physical deterioration. Next is confusional state. The term confusion is derived from Latin word confusio, which literally means to mingle together. It is the condition of being confused or indistinguishable in one's mind about something. The word acute mental confusion is frequently used interchangeably with hallucination in International Statistical Classification of Diseases and Related Health Problems, and generally refers to loss of direction, that is, capability to put oneself suitably in the globe by time, place and individual identity, and sometimes accompanied by disordered awareness, that is, loss of linear thoughts, and loss of memory, that is, the capacity of rightly remember earlier proceedings or find out new material. Next is functional psychosis. In functional psychosis, behavior or experience is altered, but the cause of this psychological state is not yet identifiable. First type of disorder is schizophrenia. Schizophrenia is a challenging disorder that makes it difficult to differentiate between what is real and unreal. Think clearly, manage emotions, relate to others and function usually. It is a brain disorder that causes the manner in which the individuals act, think and look at the world. It is mostly characterized by unusual social behavior and failure to identify what is original. Common symptoms comprise of false beliefs, audio hallucinations, puzzled or unclear thinking and inactivity, and diminished social involvement and emotional expression. Next is paranoid state. Paranoid state or paranoia is a thinking method supposed to be greatly inclined by nervousness or fear, often to the spot of delusion and irrationality. Paranoid thoughts characteristically comprise persecutory viewpoint or beliefs of conspiracy regarding an apparent danger towards oneself. Example, everyone is out to get me. Paranoia is separate from phobias, which also include illogical fear but typically no guilt, making fake allegation and the general disbelief on others also often accompany paranoia. For instance, an event most persons would vision as a misfortune or accident, a paranoid person may consider it was deliberate. Next is affective disorders. Bipolar disorder, which is also known as bipolar affective disorder or maniac depressive disorder or affective psychosis, is a mental illness characterized by events of elevated mood followed by the periods of depression. Symptoms of bipolar disorder are severe. They are diverse from the usual ups and downs that each one passes through from time to time. The elevated mood is significant and is called as mania or hypomania, depending on the severity. During mania, a person feels or acts abnormally glad, energetic or irritable. They usually make poorly thought out decisions with little regard to the consequences. The requirement for sleep is generally reduced. On the other hand, during periods of depression, there may be crying, poor eye contact with others and a negative outlook towards life. Other mental health issues such as anxiety disorder and drug misuse are commonly associated. People with bipolar disorder experience unusually intense emotional states that occur in distinct periods called mood episodes. Each mood episode represents a drastic change from a person's usual mood and behavior. Mania is the defining feature of bipolar disorder, which is an overly joyful or overexcited state. A depressive episode commonly follows an episode of mania, which is an extremely sad or hopeless state. Sometimes a mood episode includes symptoms of both mania and depression. This is called a mixed state. People with bipolar disorder also may be explosive and irritable during a mood episode. Next is neurotic disorders. Neurotic disorders or neurosis is a class of functional mental disorders involving distress but neither delusions nor hallucinations, whereby behavior is not outside socially acceptable norms. This is a condition in which the patient suffers from emotional or intellectual disorders but does not lose their touch with reality. It is also known as psychoneurosis or neurotic disorder, and thus those suffering from it are said to be neurotic. Chief symptoms involve anxiety, sadness or depression, anger, irritability, mental confusion, low sense of self-worth, phobic avoidance, impulsive and compulsive acts, lethargy, etc. On the other hand, cognitive symptoms include unpleasant or disturbing thoughts, repetition of thoughts and obsession, habitual fantasizing, negativity, etc. Next is personality disorder. In psychological context, personality is defined as the set of enduring behavior and mental traits that distinguish human beings. Hence, in the simplest manner, personality disorders may be defined by experiences and behaviors that differ from standards and expectations of the social culture. Personality disorders are a class of mental disorders characterized by enduring maladaptive patterns of behavior, cognition and inner experience, exhibited across many contexts and deviating markedly from those accepted by the individual society. It is a type of mental disorder in which the person acquires a rigid and unhealthy pattern of thinking, functioning and behaving. This acquires significant problems and limitations, especially in relationships and social encounters. That's why such persons face trouble in perceiving and relating to situations and to people. In some cases, persons with such a disorder denies of accepting the fact that they are suffering from any kind of behavioral abnormality because the way of their thinking and behaving seems them to be normal or natural. Patterns of personality disorder develop early. These usually begin in the teenage years or early childhood. There are many types of personality disorders. Some types may become less obvious throughout middle age. Next is sexual deviation. Sexual deviations or sexual perversions are habitual acts aimed to obtain sexual gratification without sexual intercourse. A person who is indulged in such acts is known as sexual pervert or deviant. Some common sexual deviations are: first is sadism. It involves gaining sexual pleasure from seeing others undergo discomfort or pain. The word sadism was created by Richard von Krafft-Ebing after Donatin Alphonse Francis de Sade, in 19th century French writer and philosopher. In extreme cases, there is a frenzy to commit a violent act known as lust murder. Next is fetishism. This is a perversion in which sexual gratification is obtained by contact or sight of certain parts of female body or even an article associated with her, known as fetish objects. Next is masochism. This perversion is reverse of sadism. Sexual gratification is obtained by receiving a painful stimulus from the partner. Generally, sadism and masochism are found together with one type dominant over the other. This combination is known as bondage. Next is transvestism. This is a perversion in which the personality is dominated by the desire to be identified with the opposite sex. It is more commonly found in females who dress themselves in male attire. Next is exhibitionism. As name suggests, the term applies to the acts involving the exhibition of genitals. This perversion is found in males and very rarely in females. We'll conclude this module with the summary. The grouping of psychiatric disorders also recognized as psychiatric nosology or psychiatric taxonomy, is a crucial facet of psychiatry. Mental retardation, also identified as intellectual disability or learning disability, is a generalized disorder appearing before adulthood, characterized by significantly impaired cognitive functioning and deficits in two or more adaptive behaviors. Psychosis is characterized by withdrawal from reality, as if living in another world, a world of fantasy. Dementia is an extensive kind of brain diseases that cause long-term loss of the ability to think and reason clearly that is starkly adequate to disrupt an individual's daily functioning. Drug-induced psychosis or substance-induced psychosis, normally recognized as toxic psychosis, is a type of disorder related to substances where psychosis can be accredited to substance use. The term confusion is derived from Latin word confusio, which literally means to mingle together. It is the condition of being confused or uncertain in one's mind about something. Schizophrenia is a challenging disorder that makes it difficult to distinguish between what is real and unreal, think clearly, manage emotions, relate to others, and function normally. Paranoid state or paranoia is a thought process supposed to be deeply predisposed by nervousness or fear, frequently to the point of delusion and irrationality. Paranoid thinking characteristically comprises of persecutory beliefs or beliefs of conspiracy regarding an apparent threat towards oneself. Example is everyone is out to get me. Bipolar disorder, which is also known as bipolar affective disorder, maniac depressive disorder or affective psychosis, is a mental illness characterized by stages of raised mood followed by the phases of depression. Next is neurotic disorder or neurosis, is a class of functional mental disorders including agony but neither delusions nor hallucinations whereby behavior is not outside socially acceptable norms. Personality disorders are a class of mental disorders categorized by enduring maladaptive patterns of behavior, cognition, and inner experience exhibited across many contexts and deviating markedly from those accepted by the individual society.